Signs of irregular ovulation. If you're not ovulating, however, you can't get pregnant. And if you're ovulating irregularly, it may be harder for you to conceive. Anovulation is the medical term for not ovulating. 6 Oligovulation is the medical term for irregular ovulation. These can be signs of an ovulation-related problem. Irregular or missing periods. It's normal if your menstrual cycle varies by a couple of days each month. It's not normal, however, if the variation spans several days. Similarly, a normal cycle can be as short as 21 days or as long as 35 days. If your cycles are commonly shorter or longer than this, you may have an ovulation problem. Assuming you're of childbearing age, not getting your period at all or going many months between cycles can both be strong signs that you're not ovulating. In these cases, it's important to get checked out by an OB/GYN specializing in fertility issues. No rise in basal body temperature. If you've been charting your cycles and you don't see a slight increase in BBT, it's possible you're not ovulating. However, some people don't get the rise in BBT, even if they are ovulating. Why this happens is unknown. Also, irregular sleep patterns and not taking your temperature at the same time every morning before getting up for the day can throw off your charting results. Inconsistencies in ovulation test results. Ovulation test kits detect the hormone LH, which surges just before ovulation occurs. If you never get a positive result, you may not be ovulating. Oddly enough, getting multiple positive results can also indicate an ovulation problem. This implies your body is attempting to trigger ovulation but is not achieving success. Think of it as a misfire. This is common in people with polycystic ovarian syndrome, PCOS. Medical tests for ovulation. If you suspect you're not ovulating or ovulating irregularly, see your OB/GYN or healthcare provider. You may have a fertility problem, and it's important you get things checked out soon. Some causes of infertility worsen with time. The most common way for your healthcare provider to confirm if you're ovulating is with a progesterone blood test. The hormone progesterone rises after ovulation. If you're not ovulating, your progesterone results will be abnormally low. This test is usually done on day 21 of your cycle. Your OB/GYN or healthcare provider will also likely run other blood work during fertility testing, which can help determine why you may not be ovulating. They will also test your FSH and AMH levels, along with estrogen, prolactin, androgens, and thyroid hormones. Your physician may also order a transvaginal ultrasound. An ultrasound will enable your doctor to see if follicles are developing in the ovary. After ovulation, ultrasound can detect whether a follicle broke open and released an egg.